When 34-year-old Jennifer Wagner found a lump in her breast 6 years ago,
Hey, I made it!
She headed straight for her doctor.
I asked him, I said, should I go for a mammogram? And he sort of poo-pooed that idea.
10 months later, a second doctor also told her there was nothing to worry about. But a year after that, another lump appeared. The doctors, both affiliated with the sprawling University of Michigan health system, had made a terrible misdiagnosis.
The ultrasound technician said, this is breast cancer. And I was just like, wow. After 21 months of it growing, it went from what could have been stage 0 or 1 to stage 3.
Furious, Wagner called malpractice attorney Tom Blasky, and they prepared to sue.
We would have started the war.
But instead of going to court, the University of Michigan health system did something astounding. It quickly examined the case, admitted it was wrong, offered Wagner a $400,000 settlement, and apologized.
That validation meant more than $1 million.
With the other hospitals, you don't get any of that. You just get the deny, 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 defer, defer, defer.
It's important to understand that litigation is not a search for the truth.
The policy of transparency and apology was initiated at the University of Michigan by Rick Boothman, who spent 30 years defending hospitals in malpractice cases.
Because it's a game. I could have found oncologists to say, oh, she's had cancer for 5 or 6 years. That delay made no difference in her staging. But that wouldn't have been true.
The policy started in 2002, and it's proven to be a shrewd business practice for the 40-member hospital system. Since then, claims against the system have dropped from 262 in 2001 to 83 in 2007. Fewer claims have allowed the system to drop its malpractice insurance reserves from $73 million to $13 million. And the hospital's new openness has another positive effect. With doctors less likely to be sued, they're reporting negative outcomes 6 times more often.
There's just a general culture that's come about here of being more forthright, taking responsibility, meeting it head on.
A win for the health system and a win for Wagner. Money from the settlement is in a college trust fund for her boys. Now in remission, she's able to enjoy her healthy body today and has peace of mind for her children's future. Priya David, CBS News, New York.